I want to talk about mental illness. Let's say I go to the doctor and I get a bunch of tests done, and the doctor comes back and says, yep, you're mentally ill. You've got, schizophrenia. What do you do next? Does the doctor just say, good luck, kick him in the butt, send you on your way? No, you evaluate treatment options, right? So now let's say the doctor says, for schizophrenia, there's 2 medications you can take. Medication A, when people take medication A who have schizophrenia, they're happier, they report less anxiety and depression, they commit suicide at lower rates, they're less stressed. Medication B, the opposite happens. Patients report more anxiety and depression, they commit suicide at higher rates, they're more stressed. 2 questions, which one of those 2 am I going to want to take? And second question, which one of those 2 do you think leads to a population of people who are less mentally ill? I'm going to say it's the one who take medication A, the ones who report less depression and anxiety and commit suicide less, right? So when it comes to being trans, when I keep hearing conservatives say that being trans is a mental illness, even though it's not, right, there is a literal manual on mental illness. It's called the DSM-5, and it's written by doctors, psychiatrists, especially neuroscientists, anyone who knows what they're talking about in this field. That's written by experts in the field of mental illness. It explicitly says being transgender is not considered mental illness. So when I say being transgender is not a mental illness, I have the entire scientific and medical community, backed up by decades of research, 70 plus years of understanding that gender is different than sex, to back up my claim. You have your feelings. So the whole facts don't care about your feelings thing is such a projection on so many levels. Let's go down this rabbit hole. What do you think we should do to treat them? Either you think trans people are who they say they are, and you provide them care to affirm their gender, right, which is gender-affirming care, and it can be as simple as putting them in contact with a mental health professional or a doctor, right, or a therapist or a psychiatrist, someone who can decide if there is some physical treatment necessary for that trans person or not, because they can decide that, and it's still gender-affirming care. Or you don't think they are who they say they are. You think they're sick in the head. The gender-affirming care equivalent on that side is conversion therapy.